So in this video we are going to see the test for the biceps tendon. So biceps tendon can most commonly accompanied by the degenerative process of the subacromial space due to its anatomical proximity to it, and rotator cuff tears is also accompanied by this biceps tendon tear. So we are going to see about the speeds test in this video. It is a patient will be sitting and the examiner rests the shoulder forward flexion while patient is sitting. The patient's forearm is in supination, okay, in this test, and the pain in the region of the bicipital groove suggests the disorder of the long head of the biceps tendon, okay. So this is the speed test. This is very easily performed. We will resist the forward flexion of this patient. So the next test is the Ergason's test. Patient will be sitting and the shoulder is forward flexed to 90 degrees. The patient's forearm is pronated. So the examiner will resist the supination. We'll ask the patient to do the supination. So the examiner will resist the supination. In this, the pain will be felt in the biceps groove and there will be a pop out. Okay. The pain in the biceps groove is a sign of the biceps tendon lesion, and the ligamentous connection also is checked here. Now the typically provoked pain can be increasingly pressing on the tendon in the biceps groove. So this is a special test for biceps tendinitis and transverse humeral ligament. So this test is for the biceps tendinitis and the transverse humeral ligament. Patient is seated with the arm 90 degree abducted and internally rotated, and elbow is extended. From this position, the examiner externally rotates the arm while palpating the bicipital groove. Okay, this point. So while palpating the bicipital groove, it's to verify whether the tendon snaps or not. In presence of ligamentous insufficiency, the motion will cause the biceps tendon to spontaneously displace or snap out of the bicipital groove. Pain is reported without displacement of the biceps tendinitis, or suggested pain is reported without displacement. So it is going to suggest there is biceps tendinitis in the bicipital groove.